This is Mary Minetti. I'm with the Institute for Patient and Family-Centered Care, and we're going to go ahead and get started with the PFCC Connect virtual discussion on building and sustaining vibrant PFACs. Before we go too far, I just want to share a couple housekeeping items. Please put your phones on mute and do not put us on hold if your organization has some kind of music that plays while you're on hold. Just mute your phone if you need to step away from your phone during the course of this informal conversation. And if you can, we'd love it if you could join us by video cam. I know that in some organizations you don't have cameras or can't use cameras on your phone. Over here too. So we appreciate when you can, but if you can't, that's fine as well. I want to just kind of outline, we've got an hour today. We have a number of people on the phone and a number of people who registered for this conversation, but will be listening to it in the recording mode later because of their schedule. I'd like to go ahead and have the opportunity to introduce the staff who will be supporting this effort. As I said, I'm Mary Minetti. I'm the Senior Policy and Program Specialist, and I'll be moderating this call. Ishma, would you like to go ahead and introduce yourself, please?
Sure. Can you hear me okay?
Yep, we can hear you.
Great. So my name is Ishma Patel, and I'm the Director for Special Projects and Educational Programs at IPFCC. I provide overall direction and
Ooh.
So excuse me, Ishma, I'm hearing some background noise.
I'm listening. I'm on a phone conference.
Thinking that this may be related to people having their computer speakers on as well as their telephone speakers. So, Annette, if you can mute the audience, that would be great, since we're having some difficulty in getting people to mute. And we want everybody to be able to hear if they participate in the discussion. So if we go ahead and introduce yourself, if you would, please.
Okay, can you hear me okay now?
I can.
Great. I don't hear any feedback either. So hopefully we're good to go. As I was saying, my name is Ishma Patel, and I'm the Director for Special Projects and Educational Programs at IPFCC. In this role, I provide overall direction and management for our educational programs, such as the conferences, seminars, and webinars. Prior to joining IPFCC, I worked for the American Institutes for Research, where I provided technical assistance to the Hospital Improvement Innovation Networks and their member hospitals as part of CMS's Partnership for Patients initiative. I'm also a volunteer for the Preeclampsia Foundation as a member of their Patient Advisory Council and have been involved with the PFAC for Duke's Pediatric and Congenital Heart Center. So I have a bit of experience with PFACs, and that said, I will be managing the beginner PFAC community on pfcc.connect. So I look forward to seeing many of you here. You will periodically see me post discussion questions and materials, so feel free to reach out at any time.
Great, thanks, Ushma. Annette?
Hi, I'm the Healthcare Program and Communications Specialist at IPFCC. I'm basically here just to make sure that the technology part goes well. I'll also be sending you the recording afterwards, and but overall I do the webinars here if anyone's ever been on one. I also help with any technical problems that you have with PFCC Connect. And yeah, so I just do all the background work.
Great, thanks, Annette. I am interested in having people, if they would please, chat in their name, what organization they represent, and what role they might have. And I just want to remind people that the goal of the PFCC Connect virtual discussions really on any topic is really to allow and invite and encourage all of you to share information about what you're doing. Today we're talking about patient and family advisory councils, and to learn from each other. So we do not have although we have some information to share at the end of the time that we're together, our role right now is to organize the conversation and pose the questions that you have chatted in when you registered and help facilitate the conversation. So I see that we have a lot of people from all over North America with lots of different backgrounds. Annette right now is going to run a couple polls so that we can actually see kind of an aggregate of who's joined the call and what settings their PFACs are working in. So if you would go ahead and look at the poll and submit your answer, that would be great. And then in a moment, Annette will be showing us the results of this poll, and then we'll be able to see the next poll, which is about where your PFAC is stationed or working from. One of the things that I noticed in terms of the registration while you're filling out the poll is that there were a lot of people interested in this particular topic with a wide range of experiences working with PFACs or being on PFACs. So I think that our conversation is going to be very rich. So Annette, should we close this poll and see what kind of response we've gotten? That would be great. Wonderful. We've got patient and family advisors and clinical leaders, as well as patient experience folks. And it looks like coordinators and patient experience people in those roles represent the largest group that has joined us. And we appreciate your participation. We always are excited when patient and family advisors can join us and share what their experiences are. So we hope all of you will feel comfortable to contribute when we get into the discussions. We're going to go ahead and close this poll and open another poll just to see whether we've, what kinds of percentages of people are working in the hospital settings or in community settings or other kinds of settings. So if you can take just a minute to identify what setting you represent, we would appreciate knowing that as well. We hope that all of you are PFCC Connect members, although this is open to others. But if you aren't a member, be sure and sign up so that you can hear about future informal conversations that are going to be occurring. We do find that the interaction between those of you doing the work on the ground with others in other settings and similar settings can really be useful. So how are we doing? Oh, look at this. Great. So a little less than half are representing hospitals and medical centers, but we've got some community folks, which I always love to see. And primary care is near and dear to my heart since I worked as a quality director in a multi-specialty practice for a number of years. So this is great as well. So we have a sense from, if you've been kind of watching the folks sign up on the chat, as well as looking at these polls, we've got really a richness of people and experiences here to share in this conversation. So if we can go ahead and start the conversation. So one of the things that people did quite well, and I really appreciated it, was you chatted in your questions when you registered, things that you were interested in having a conversation about. And what I did is I took a look at all of those questions and looked at the key areas that individuals were interested in discussing. A big area of conversation was around recruitment related to diversity and inclusion, just some tips and tools related to logistics and meetings and strategies that the individuals have had related to PFACs. People were interested in knowing what kinds of things different PFACs from around North America were accomplishing. And then, of course, in order to have a vibrant PFAC, we need to be able to sustain it, as well as looking at particular challenges that individuals have. So what I'd like to do is, now I know for a while so that we could eliminate some of the background noise, Annette basically muted everyone, but she's going to open up the lines. And what I'd like to do is I'd like to start with recruitment and have people share ideas and strategies and things that they've worked on related to recruiting patient and family advisors for their patient and family advisory councils, especially those that have ideas and experience and successes related to the issues that came up related to turnover, inclusion, diversity, onboarding strategies, and term limits. So I generally don't call on people, although I can, but I'd like to just open it up. So who would like to share thoughts and ideas and success strategies that they've had that have helped them recruit patient and family advisors onto their councils?
Hi, I'm Christine Coury, and I'm the manager for patient experience at a children's hospital, and in my portfolio is patient engagement. We've had a family advisory council for over 25 years, and recently actually did a reach out to families on specifically this question: if we wanted to recruit more family advisors, what's the best way? And what we've seen, what was echoed from these families who didn't even know we had an advisory committee, was that really your number one reach out should be through your staff. They're the ones who give the families confidence that this is something they would be good at. They can explain it a bit and provide that introduction. Our traditional methods of social media, of posters, really haven't led to much success.
Great. Well, you certainly have had some lengthy experience, and I love the idea that you reached out to your families to get their ideas. So that trusted relationship and inviting people in who have trusted relationships with healthcare professionals and members of the organization is a great strategy. What other strategies have individuals used related to recruiting folks, especially those from diverse populations? I know that sometimes individuals representing the behavioral health sphere are an area that individuals have found difficult. Do others have ideas about that?
Hi, my name is Susan Fitzgerald from Flecker Hillside.
Great.
And we are a behavioral health hospital who started the process of developing the patient and family council in late summer. We have had challenges in recruiting family members, and the family members who've been kind enough to join our council, because they're so overwhelmed, have a hard time focusing on the goal of the council and tend to become more involved in speaking at length about their own family situation. I don't know if anyone else in behavioral health has had this experience as well, and if anybody has any pointers for us.
Great. Thoughts from anyone around this topic? I know that Alyssa Nelson was going to be joining us, and they have done a number of things with behavioral health.
Yes.
Okay.
Thank you. I was actually going to speak up, Mary.
Oh, great, Alyssa. Well, we're on the same wavelength. Go ahead and share what your experience has been, please.
Yeah. So, oh, somebody just put us on hold. Well, if you can hear me over the music, I have experience as a quality improvement advisor helping LA County mental health clinics implement their own patient advisory councils, and also as a participant on a council myself. So there are a few things that are really, really helpful in this situation. In terms of you know, folks with mental health challenges and their families bringing a lot of themselves into the conversation. I think giving people the space and the time to check in at the beginning of a meeting and just kind of establishing that groundwork, or just the conditions that they're experiencing right now and what they might be bringing into the room, that can be a really powerful exercise for people to participate in, both, you know, the person who's bringing the stuff into the room, but also everybody around them, just to understand, okay, this is your context and this is what you're dealing with right now. And that's going to help frame the discussion. I think pretty much every council I've participated, we had something like that. So that's one piece about just maintaining the meeting and staying on a topic. I think if the person who's organizing the meeting has some stuff to discuss and is prepared for that in advance, that's really helpful. So if they have a question that they want to present to the group about a policy that they're thinking about implementing within the clinic, in the LA County DMH clinics that I work with, the clinic head is the person who runs that whole meeting. And so they usually have something that is coming down from the county that they have to implement, that they need some patient feedback on, and it's just a good frame for this discussion. So for example, one of my clinics is working on implementing multidisciplinary care teams, and they brought that to their client council and said, hey, what's your feeling on, you know, here are some of my concerns on this new policy shift, and I'm really curious to hear what yours are from the client perspective. So that's one thing.
Great.
That I've experienced personally that was really, really helpful to me as a participant on not exactly a client council, but on a speakers bureau for a community mental health treatment facility, was having training ahead of time to help give me some tools to be able to manage some of the stuff that comes up when you're like translating your own lived experience into policy shifts within an organization. So I had a 40-hour training with the San Francisco Trauma Recovery Center that really helped give me a sense of like, here's how I can share my story without triggering myself in the process. So just some ideas.
Great. You've shared a lot of really great strategies that can be helpful, not just with the behavioral health population, but with others, especially as it relates to helping facilitate meetings and encouraging people and setting some boundaries, but also making space for people to share their stories and things. I'm wondering if diversity of recruitment has often been an issue for people, getting minorities, people, marginalized populations on councils and keeping them on councils. Does anyone have a particular experience that they want to share about successful ways that they've been able to prepare and onboard populations that often are hard to recruit to councils?
Hi, this is Vicki Kelly from Cook Children's in Fort Worth. And one thing that we tried is we designed t-shirts that are recruitment t-shirts for our Parents as Partners program. And so on the t-shirt that staff and our existing family-centered, our family advisory council members wear, we have gotten at least, we just had those out since October. So we've gotten a few phone calls based on our staff wearing that t-shirt and being curious enough to call us. And those t-shirts are done in both English and Spanish.
Wonderful. That's a very innovative approach. And I'm also noticing that I don't know how many people are kind of looking at the chat, but we've had individuals chat some ideas in as well. I see that Valencia has talked about using their advisor stories, showing the impact and disseminating these stories in diverse ways, both in terms of community groups and Facebook and churches and those kinds of things. So that's useful. And Muriel has talked about how your current patient and family advisors can help identify other patients and family members. So those are all great kinds of recruitment strategies, especially the comment about recruiting from churches. Often when we're trying to recruit diverse populations, looking at where people from different populations go to get trusted resources or have connections, and then reaching out to those trusted resources. And it might be a faith community, it could be a community center where people gather to invite people in. So we've gotten some ideas about recruitment, both in terms of people sharing and also in terms of people chatting things in. So I really appreciate those ideas. What I wanted to do is have an opportunity for people to share, since it came up a lot in the questions that came up. People really wanted to hear what different organizations and PFACs have accomplished in partnership with each other. And so I'm curious. I know Bernice and Marie had some ideas, and Dejo Miller are on the call and have worked with their advisory councils and accomplished a variety of things. But I'm wondering if one of you wants to share some of the accomplishments that you've had in your PFACs, and then we'll open it up to others.
Sure, it's Bernice here from Hamilton, Ontario. I've joined the PFAC at St. Joseph's Hospital in Hamilton on the year 2015. And I kind of got a sense from people who had been on the PFAC for a while that they didn't feel they had accomplished very much. So over this past summer, I summarized all the minutes from 2011 when the PFAC started right up to 2017 and showed from each of the minutes what they were working on, what they accomplished, and then at the end put some conclusions which showed that some of the things had worked very well, others hadn't, but it didn't mean that they shouldn't try them again, because we learn from areas and mistakes, and that I certainly encouraged us to try them again. I think that seemed to work quite well, because all of a sudden people saw that they had accomplished quite a great deal.
Thank you, Bernice, for sharing that. I think that the point there is that it's always good to keep a kind of a running track record of what you've accomplished, and your point is well taken. You know, some things as projects go well and some don't go so well, but those are all opportunities to learn how to create better partnerships. I'm wondering if other people have things that they've accomplished in partnership with their PFACs that they'd like to share. Just as examples, Bernice really talked about the process of gathering all accomplishments together, but often we can learn from each other about what PFACs are working on. So what kinds of things are you working on, those of you that are on the call, with your PFACs, and how do you track your accomplishments? I noticed on the chat that Angela has said that they've done some work in terms of facility improvement and developing wayfinding. I know that that's a common project and work that many hospitals and other settings have found really useful, because patients and families kind of experience our environments differently than we do when we work in them every day, and they can really help us make that wayfinding process easier.
Mary, this is, and I would also add that we have been asked to get involved in developing infection control policies and procedures, giving input on in the area of infection control. We're not actually developing them, but typically we have somebody who comes to the PFAC and shows us something that's in the early stages of development, and then asks what we think. And mainly what happens is that we tell them too scary photographs of, dying cells or something, and please don't do that. That's typically what we start with, and then go on and obviously ask them to simplify the language, and we've done a lot of that.
Great, that's wonderful, and I love that example because it's a safety example. It's a how do we engage our PFAC in helping us keep our environment safer, and infection control is certainly an area. I'm noticing that on the chat we've got some number of ideas that people have shared in terms of patient presence policy and accreditation preparedness, utilizing advisors as tracers. Rayanne, did you want to talk a little bit more about the patient presence policy and how your PFAC has been involved in that? It may be that Rayanne isn't able to join us verbally. I know that, and I didn't mention this at the beginning, when we have these informal conversations, what we've learned is some people are in settings where it's a common setting with multiple people, and so they're not able to participate in the audio, and so the chat is a great way to participate without having audio. So sometimes when I call on people, they're not able to respond. What other kinds of accomplishments have people had?
This is Alvina Bergeman from Health.
Yes.
And
great.
So I just wanted to share something that one of our ongoing PFACs at the Children's Hospital has been doing. And what they did was to actually ask patients about their thoughts on preparation for surgery. So they had talked to surgeons and found out that, not all patients were coming prepared, and they had to cancel some surgeries. So they were really interested in improving the rate of prepared patients. So they went to patients and talked to them and said, well, what would you want to know? What would be helpful? What are maybe some of the reasons that you may be going against doctor's orders, so to speak? And then they got the real stories. So for instance, well, why would it be so bad to give my child a drink of water before bed, right? What, boy, I wish I had known this. And so what they did was to actually create a little website prototype, including the reasons behind the pre-surgery regulations. And then they brought that to patients in the waiting room, said, what do you think about this? They changed the design, created a prototype online, went through that process again, that design process. And then by the end, they came up with a pre-surgery website as well as an app, and it appears that rates, I don't have the numbers with me, but I think they jumped something like 40%. So a lot of patients came prepared to surgery, and I think it was 9 out of every 10 patients were ready by this time, just by having that information at their fingertips, and they were involved from the beginning in that process.
Wow, what a great story! Thanks for sharing it. The thing that I'm reflecting on is that not only did you get feedback, but you created tools and ways of communicating with people broadly so that it really reached people. And you mentioned that you developed an app. I know that one of the questions that came up for people that registered was, how are people using technology and to really sustain their PFACs and also broaden their reach of getting feedback about individuals, feedback from individuals about things that they need assistance in and in improving. Marie McNaughton, I noticed that you chatted in that your advisors have been extensively involved in improving the transition from pediatric to adult services. Can you talk a little bit about what changes were made as a result of their participation and involvement in that particular topic?
Right. Well, we've had some a few involvements. I can give you one example of our Child Advisory Council, who have been consulted regularly on this. And one of the things that was identified is that they needed to have a way of preparing, or for youth to have access to a way to help them to prepare for the independent skills that they need. So that our youth provided some ideas on what that would look like, and then they actually created a working group that developed a workshop that is now led by youth peer mentors, and it's held in conjunction with a parenting workshop at the same time. So they consulted on what was needed, and then they actually helped to create that. And the other thing that we've done is we've had a lot of requests for advisor involvement. So we created a separate advisory council specifically for this, and they consult on the projects on an ongoing basis. So they've been working on the creation of a pathway so that all of our clinics are identifying youth at 12 and then going through a pathway to make sure that their preparation is done for them to be independent. And so they, that group meets every 2 months, and those projects come back to them all the time. So that's just a brief summary of it, but that's what it looks like.
Great, great. Thanks. Sounds wonderful. I noticed that Deborah talked a little bit about their work with patient portals. Deborah, I don't know if you have audio so that you might share a little bit more about that, but I know that there are a number of organizations that have portals in place, but the utilization of them is pretty low. So I'm curious what and how your Patient and Family Advisory Council contributed to improvement in your patient portals.
Yeah, so I actually work at Open Notes, so it's a national initiative. It's based at the Israel Deaconess Medical Center in Boston, but we actually have developed a national HIT PFAC, so that's kind of a side note. But with the work that we've been doing with trying to engage health systems in sharing visit notes through the portal, we've been introduced to a number of health systems that have said, you know, they either have 1 or 2 advisors on a system-wide Health Information Technology Council, and or they have worked directly with the entire PFAC to get their feedback on improving patient access and navigation and kind of the information that they have on the portal. And then there are some places, I know UCLA, for example, has actually a PFAC specifically for health information technology related issues.
Great, thanks. There's a question that's come in from someone on the call who's wondering if anyone on the call is working with PFACs in the community sector, and whether they want to share what their experience is with their PFACs that are community-based in terms of recruitment, or what kinds of things, if you have a PFAC that's community-based, what kinds of things do they work on? Do we have anybody that has those kinds of experiences that they'd like to share?
I can share what LA County Department of Mental Health is doing around this. They have a program called the Service Area Advisory Council. The County of Los Angeles is really big, so it's divided into 8 different service areas that are geographic, and each one of those service areas has its own advisory council, and those meetings are open to anyone in the community. They really encourage consumers and their families to attend. Attendance isn't great, and it's a really dry meeting, so it's not a great example of how to keep people engaged over the long term, but I've been to them and people do attend. They also have a county-wide meeting where that is open to consumers and to really anyone in the community that knows about it. But I think transparency in some of these processes is kind of lacking. So it can be hard to really get that information out into the community outside of their peer program, which is really robust in LA County. So they really rely on peer employees and volunteers and people who are participating already to get the word out within both the patient population and the wider community.
Great, thanks for sharing. Is there anyone else that's been doing some community groups? I can share something about community groups in Oregon, because Oregon, as part of their Medicaid legislation, they have in each of the geographic communities created community advisory councils that consult with and provide advice to the Medicaid policymakers in a particular location. So in my community, which is in Lane County, Eugene, Oregon, the Community Advisory Council is made up of 51% of individuals who receive Medicaid services or are parents of kids that receive Medicaid services. And then the other 49% is made up of individuals who represent community organizations that provide social service support. So like United Way or the Disability organization or the Mission. And they recruit utilizing clinicians who recommend patients that they see, but they also do a lot of outreach into the community using the newspaper, using social media and those kinds of things. And then they do some training of those who are part of the Community Advisory Council. And they've had really good and great luck in Oregon with these community advisory councils because they have a liaison who works with those councils to make sure that the engagement is meaningful between meetings as well as at meetings. So that's a model that potentially organizations that are interested in community-wide advisory councils might be interested in learning more about, and I'd be happy to put a link in the PFAC beginner group folder for people to be able to go out and learn more about those community advisory councils. I'm going to shift gears a little because we've had some people post some questions. There's a lot of chatting about whether or not individuals in their advisory councils provide honorariums or whether they're volunteers and those kinds of things. And a lot of comment about that, providing food, helping reduce the cost for people who might not be able to participate in the advisory council because they can't afford parking or transportation or those kinds of things. And so those are all really good avenues to pursue. Although I know that there are a number of advisory councils that don't provide honorariums, and yet they still have really good attendance and participation. I'm wondering if there's anybody, because there was a question that got raised related to individuals. Is there anyone from a medical group or who has worked with practices in setting up PFACs, and how have PFACs gone in terms of in medical group settings as opposed to hospital settings? I know we had 44% who were in the hospital arena, but many hospitals own medical groups now. And there were those of you that also indicated that you were from primary care or ambulatory care. So are anyone that has some experience with that they wish to share that might be helping Catherine Heath understand what others in the same arena as her are experiencing?
Hi, are you able to hear me?
I can.
Hi, this is Avelina. My name is Avelina Ortega. I'm from University of New Mexico Health System.
Great.
And we have quite a few councils in our medical practices. We're a health system, so we have a medical group, and then we have clinics associated with our hospital. And then we also have another adjunct hospital that has clinics as well. So we have a pretty big system. We have patient family advisory councils in a lot of our primary care clinic locations, and some also in our specialty clinic locations. I'm not sure if she had specific questions in terms of, or just like how to, like what our structure looks like, or kind of how we got started, or.
Could you talk a little bit about your structure and who in the medical group is running those advisory councils? Often it's the logistical things in medical groups that people get tripped up about because the medical group may be a little smaller than like a hospital system. And so how do, you know, what kinds of resources does it take? And what would you say are your lessons learned about your work in the medical group? What would you recommend people think about?
So from what I've learned, in some groups, it's the clinic director who runs the group. In other areas, it's the quality manager that runs the group, and they don't really run the group, but they assist administratively. They order food. They assist the group chairs in finding out answers to questions, or helping them implement something, or break down barriers. So they're kind of more of just like a support for the group. They don't actually run the group. In some of our other areas that have the directors running the groups, those take a little bit more of an active role in sort of structuring the meetings. But what we've done in the last year is we've started to expand that model, and we've asked advisors from those sort of existing groups to come to a larger health system and look at this from a health system ambulatory perspective. And what we are working on is a larger group that anyone in the health system could access if they wanted to get patient or family input. They could come and they could bring what they're working on, and they could present it to the group, and ask them what their thoughts are on it from the patient perspective. And then also we're working on identifying which patient advisors would be good for what councils and committees are already existing in our health system. So that's kind of how we're working on it, where we're at.
Great, thanks for sharing that. So we've got about 15 minutes left, and I want to be able to have an opportunity to really focus a little bit on the issue of how to address challenges, but also how to sustain the vibrancy of patient and family advisory councils. So I'm wondering if someone has some lessons learned that they would like to share about things that they found most useful in sustaining the momentum of the advisory council. Now, a number of you had advisory councils in place for more than a couple years, so obviously you've done something to sustain that. I noticed that Christine talked about closing the loop on activities that the advisors have contributed to in the chat, which is a way to sustain. Oftentimes, advisors want to be involved in meaningful work, and they also want to know how the input that they've provided has made a positive difference, because most people want to join advisory councils to make a positive difference. What other things have people done to sustain or engage their individuals outside of the advisory council meetings? Anybody using any technology to keep lines of communication open?
This is Alvina again. We actually haven't tried it yet, but we do have a group that is starting up and is run by our 2 patients actually from our cystic fibrosis group. And they've developed a charter, and they realized that because of their patient population who is immunocompromised, it doesn't work to meet in the same room. So they're looking into options as we speak in doing an online only version of a PFAC.
Great, great. I know some organizations have a a Facebook page where the group kind of chats and interacts between meetings. Some people have an email group that they reach out to on a regular basis between meetings. So that is, so that's an important thing to think about. I'm curious, some advisory councils end up losing momentum because they are kind of separate from the work that the strategic work that the organization is doing. And the earlier comment about getting the advisory council involved in infection prevention is a great example of really integrating the advisors into work that is important to both advisors, but also a strategic initiative of a hospital setting. What other ways are people making sure that the PFACs are integrated into the fabric of the organization? Are there any ideas or suggestions out there?
Mary, this is Vicki from Fort Worth again. Each year we look at the strategic initiative of our hospital or our health system, and we align our goals with those. But another thing that we do is we have a regular meeting with the leadership of each of our family advisory councils. We have a total of 13. And so the staff liaison along with the parent chair are invited to that meeting. Actually, anyone from their advisory council that can make that meeting, because it's during the day, so sometimes that's a challenge. But our FACs are represented at that meeting, and so the ideas then are shared with, that come from that meeting are shared with all of the other advisory councils. So if someone is working on a project and another advisory council gets interested in doing the same kind of thing, then they can either work together on that, or that advisory council takes that idea and can run with it.
Great. That's wonderful. Thank you for describing that process. It sounds very systematic and disciplined, and creates a structure that really is going to drive success. That's wonderful. Does anyone, I know we have some clinicians on the group, does anyone have any ideas or suggestions about how best to engage clinicians and staff in supporting the Patient and Family Advisory Council? People are always asking for ideas related to that particular topic. Feel free to chat in.
Go at it.
Great. And who is this?
Bernice King.
Great, Bernice.
At our PFAC meeting, in fact, the board member always attends. They take turns on who attends. We also have a representative from the managers group, so that they can see what we're discussing and involve us. We also go out to the managers meeting and talk about the PFACs, what they are and what we hope to do, again, to try and keep people on top of it.
Great, great. Does anyone else have ideas and thoughts about the engagement of clinicians and other staff? Feel free to chat them in.
So this is Angela again. We had two physicians in our emergency department who actually got a PCORI grant. And obviously when you have PCORI, you are almost by nature interested in patient engagement. But then they very kindly shared kind of their experiences with patient advisors in the emergency department to then, you know, the advisors joined the overall hospital advisory council, and the physicians then came to some of the meetings as well.
Oh, great. That's a great example. Thank you. I'm noticing that,
again.
Oh, go ahead. Yes, please.
Just a real quick we have had some of our staff write in their involvement on the advisory councils in their annual goals, so that their manager obviously knows about their involvement, but then that has helped with accountability. And so it's been nice that they have taken the initiative to do that.
Mm-hmm. Great. Well, that's a great idea. That's really a way to build it in systematically to support people in that engagement. Wonderful. Well, I'm looking at the time, and we've got about 10 minutes left. I noticed that the chat is really an active component of this. It's not just the conversations that we're having auditorily, but the chats that we're capturing. And I do want to let people know that we do keep a copy of the chat. It will be shared. I wanted to shift gears a little, just to allow some us to share something that is a resource to you that may respond to some of the key areas of discussion. But before I do that, I'm wondering if there's anyone else on the line that really wanted to comment out loud about challenges that they've experienced and how they've resolved them, or any sustainability or logistical meeting strategies for PFACs that maybe we haven't gotten to yet, but that is something that you would like to share about your experience. And for those of you that are patients and family advisors, if you would like to contribute, and I know some of you have already contributed, but if there is something that you would like to share with the rest of us about things that we should be mindful of as we engage patients and families in these councils, we would love to hear from you as well. So I'm going to just open it up for a moment to see if there are individuals who want to have some comments in these general areas. It would be great if that since chat's been utilized so much, while Annette's pulling up the next slide about PFAC best practices, it would be great if people wanted to chat in one idea that they think has been really successful in their organization, that they would suggest other organizations consider. So feel free to chat that insight into the chat area. What I've asked Annette to do is pull up this list of PFAC best practices, and I want to just give you a little bit of information about this and let you know that we will make a copy of this report available to you. But in the last year and a half, we participated with New York State Foundation to survey hospitals throughout New York State on their PFAC practices, and then we had a researcher involved, so this was a research project to really ferret out, are there some best practices that really result in improvement in safety, in quality, in patient and family experience scores? And this list that is in front of you really is those things that we identified. There have not been a lot of research studies about this, what makes a vibrant, sustained PFAC. But so this is one of the few. There will be more coming out, certainly, because there's a lot of interest in this. But here are some of the things that we found in this study. So the PFAC needs to have some structure and membership, an executive sponsor and a staff liaison who really manages and coordinates the PFAC and maintains relationships with patient and family advisory councils, that there's a clear relationship between the PFAC and the hospital leadership and board of directors. And so earlier conversation about how you do that was shared. So that the PFAC is primarily the voice of patients and families, and that they represent all the patients served by the particular organization. And then we talked earlier about recruitment, and there are some significant best practices related to recruitment being ongoing, and the important role that clinicians and staff members have in identifying potential PFAs. And some of this has come out as we've had our discussion, but it's always nice to have kind of a list, because then you can take a look at your own PFAC, or if you're just starting the process, and there were some of you who joined the call to learn because you're just starting the process, to be able to see what's really important. And then, of course, the whole point about how you bring people on and you orient them so that they can be successful in this role. And then how you operationalize your PFAC and how often they meet, and the use of agendas. And I know that there was somebody who chatted in that they had a PFAC who was Spanish speaking, so that they could really bring the voice of that diverse population in, because they didn't want language to be a barrier. And then a variety of ways for patient and family advisors to serve, and an ongoing evaluation that measures outcomes. So this study resulted in a report, and this is just a list, but there is a lot more detail. And Annette, if you want to go to the next slide, there's a lot more detail about this, this group. And what we're going to do is we are going to place on the PFCC Connect site, in the community of beginner PFACs, not in the general membership community, but in the beginner PFAC community. And if you're not a member of that subset of the community, kind of a special topic area, you can just sign yourself up. And we're gonna, in that library, create a folder to put that report. And if you click on the next slide, Annette. So in that group that Ushma moderates, we're going to put a recording of today's conversation, a copy of the chat and the ideas and the links that people suggested, the actual link to the study so you can read more information about PFAC best practices. We believe, although the study was focused on hospital systems, we believe those, from our experience doing this work for a number of years, that the research confirmed what we suspected were some best practices, and those are best practices, we believe, although we haven't researched this yet, across the continuum of settings that a PFAC could be in. And then a little more information about the New York study slides are going to be available in a PowerPoint on the site. We would encourage you, because part of the power of the PFCC Connect community is what we have just done virtually through talking and chatting, is connecting members to each other so that they can connect and create networks and share with each other ideas and suggestions. And so we really encourage you to use the library to post things that maybe you've done. I know somebody in the chat said that they'd be happy to share a picture of their recruitment t-shirts that they made in both English and Spanish, and we'd love for that to get posted in the community. We encourage you to begin or respond to discussion questions that come out of that community, just as you have in the chat. And then Ushma will be adding some IPFCC links around establishing PFACs, free downloads from our IPFCC website, so that it's easy for you to access it by just going to PFCC Connect. So we consider this informal conversation about sustaining a vibrant, building and sustaining a vibrant PFAC as a beginning conversation to kind of get you guys interacting with each other in virtual ways using our forum of the PFCC Connect. It is now almost the top of the hour. We have about a minute, but I would, and I noticed in the chat people are interested in seeing samples of recruitment flyers. And we encourage you to, again, post these in the beginning PFAC community area in the library. And if you have questions about how to do that, we really, if you want to go to the next slide, Annette, we really encourage you to just send us an email. We can walk you through that process. It's pretty straightforward, but if you're not as familiar as you'd like with the site, then we certainly can assist you in that process so that you learn how to do that and you can continue to add content and value and richness to our community. Because our community is only as strong as all of us participating and sharing and exchanging information and learning to promote strong partnerships between patients and families. So we really want to thank you for joining us, for participating both virtually through words and talking, but also through the chat. And we encourage you to continue to make the PFCC Connect conversation around how to build and sustain PFACs an ongoing conversation. So thanks so much, and watch for more invitations to other conversations. And feel free when you fill out Annette's evaluation, she will be sending you an evaluation as well as a recording of today's conversation. You can suggest other topics that we might have informal conversations on. So
excuse me, did you say there's a way for us to look at slides? I just got on a minute ago and I didn't hear if there's a site to go to.
Yes, the PFCC Connect site, and Annette will send that information out if you registered for today's conversation. Even though you've joined late, we'll be sending you a recording so you can hear the whole conversation.
Oh, okay, great. Thank you.
And feel free to send us an email too if you have additional questions. So thank you very much for the call, and we look forward to continued partnership with all of you to advance patient and family-centered care. Take care and have a great afternoon.